Hello, and welcome to the World Real Supervision podcast. My name is Dr. Cynthia Lubin-Lingtu, and I am one of the co-hosts of the podcast. We would like to thank APIC for funding this podcast and hope it will be helpful in amplifying the conversation around intercultural supervision for clinical psychology and other mental health professionals. Today, our guest on the podcast is Dr. Greg Staszko. He is a licensed clinical psychologist and manager of the Under the Rainbow program, an outpatient behavioral health program for children and adolescents at Mount Sinai Hospital. His passions lie in providing individual and family therapy services to underserved youth and their families, particularly those whose lives have been impacted by complex trauma. Dr. Staszko is also committed to providing much needed prevention services in the community through his participation in school-based and community-based violence prevention initiatives. Dr. Staszko also specializes in the impact of acute and chronic health conditions on children's mental health and has provided both inpatient and outpatient consultation throughout the hospital system for the past 15 years. Additionally, Dr. Staszko is passionate about the training of future professionals who wish to improve the health and well-being of underserved communities in Chicago. As the director of training for the Under the Rainbow program, he oversees the training of clinical psychology doctoral externs and social work interns. Dr. Staszko has been active in the development and implementation of programs within the hospital system that prioritize caregiver wellness and address issues such as vicarious trauma and compassion fatigue. This conversation highlights issues around transparency as the clinical supervisor and the importance of that in the continued professional development of both the supervisor as well as the supervisee. We are so excited to share it with you. Thanks for tuning in. Good morning, Dr. Staszko. Thank you so much for being a part of this podcast today. Excited to hear your perspective on clinical supervision and doing this intercultural work. So I'll start off with our first question. What has it been like for you to be a supervising psychologist in the context of racism, equity, and social responsibility over the years? And what has changed since you first began your career?
Yeah, that's a great question. So, well, I'm happy to, first of all, happy to be here. Thank you for having me. This is a great opportunity. So I've been thinking about this a lot, just over the last year, because it definitely feels like some things are different this year, I would say, or the last couple of years. Although the problems and the issues that came up in the past year, especially during the pandemic year, are not new, right? So these are things that, people have, various degrees of awareness of, but I mean, police brutality and some of the issues we're seeing around racism and inequality and just things that were heightened by the pandemic are not new things, right? So these are things we've always been thinking about, hopefully always been kind of talking about in supervision. But it did feel, I think the moment felt a little bit different. And I don't know if that was because there was maybe more of a kind of a popular culture response in some ways, maybe to issues around, especially around like George Floyd's murder, and there's people who maybe weren't engaged in those dialogues or conversations in the past were now engaged, and you saw responses from businesses and things in ways that corporations in ways that were new, and I don't know how helpful, but just they were new. It was new, right? So it was kind of, it felt like the dialogue was a little bit different, but I think as a supervisor, I've always been someone who's been drawn to approaches like critical psychology, right? That really kind of challenge us to look beyond the individual, right? And kind of look beyond the intrapsychic and really look at, how, people in their context, right? And again, these are not new ideas. I think the critical psychology framework kind of put it into a nice framework for us to think about how, the social, political, historical factors, the real systemic context is, affects and sometimes is maybe more responsible for an individual's emotional well-being or kind of psychological health than the traditional kind of intrapsychic factors that we always focus on in our field, right? So it's something I've always been interested in, and I always tried to kind of incorporate that and kind of work that into supervision, clinical training and supervision. But I do feel, back to the question about like what's different, I do feel that supervisees in the last couple of years feel more ready to do that. And I don't know if that's just, this could just be anecdotal, this could be unique to our setting or just, students that we've trained over the years. But I feel like in the past, when, we've tried to introduce some of those ideas, around getting supervisees to really look beyond the individual, it was met with a little bit more anxiety. And it was, kind of, and I get the challenge, right? You're learning how to do therapy. Maybe you're doing therapy for the first time and you're trying to kind of, really hone in on some things that are important and just try to keep it simple, right? And engage with clients and really try to understand. And then you introduce this idea of like, okay, well, beyond just what they're presenting with in terms of symptoms and all the things that you've been trained to like assess and think about and look at, now we have to understand like systemic oppression. We have to work in historical racism and all of these other things, right? That are impinging on this person's functioning. And it felt at times that was overwhelming, maybe to students, right? And this idea that like, well, what do I do about that? Like, do I have to do something about those things, right? I barely know what to do in the room about, right. And that now I have to kind of think about these other factors, right? So yeah, it's always something that we've incorporated into supervision and training. But I do feel over the last couple of years, the idea that you can't really separate those things seems a little bit more palatable and kind of intuitive maybe for students. And I'm not sure exactly why that is, but I mean, again, it could be unique to the students we've trained in our context. But when there isn't as much of that anxiety of like, oh, now I have to do something about those other things, but it's just a more intuitive understanding of this is who this person is who's sitting in front of me, right? This is that I can't separate out all those other factors. These are things that I have to include in my understanding of them. I have to situate them in that context and understand how those things that are happening in real time in the world may be impacting their well-being, right? And so I think there's been much more willingness, I would say, on the part of trainees, supervisees to kind of engage in dialogue around some of the current events that were happening, especially, I mean, it was inescapable, right, during that time. And this happens at different times, right? These are issues that our population, we serve a population of predominantly Latinx and African-American clients. These are issues that these are not new issues. These are things that are but then when there's these kind of big events in the media, right, it's just really inescapable. And I think that students became a little bit more comfortable, I don't know if that's the word, but willing, I guess, to engage in dialogue around current events and what's happening in real time and how that was really affecting their clients' well-being.
Yeah. So it sounds like there was an increased preparedness and willingness to engage and to dig into the situated context that clients bring to the table. And that might have been situated in sort of the flashbulb moment, right?
Sure.
The whole year. Yeah, thank you. So turning it back to you, have you had the opportunity to do your own work around racism, racial equity, identity? Can you give us some examples? And how has all of that changed the way that you work with your supervisees? Like, how has your own work impacted the ways that you do your work as a supervisor?
Yeah, great question. So, I mean, I think the first thing is we always say, I think when we're talking about the journey, right, of cultural humility and identity development, we always stress that, right? It's a journey. But it's a journey. I don't know what else to say about it, right? I've been, as a white male, also, I'm a white man working in this context, right? Working in a clinic that serves a population that has, experienced, generations of institutional oppression, a population that is, very different in many ways from myself. And then also, supervising students of color and working with, I also manage the program, right? So I'm also in this kind of dual role as director of training and then now program manager, where I'm, overseeing a program that is, predominantly, therapists of color, women of color, right? So this process, or this journey, I mean, it's never ending, right? And especially, I think, for me, being a white man in that context, right, there's so much for me to think about, every day in my relationships, and how I lead and how I interact with folks. So it's never done, right? So I think, the what it looks like though today versus what it looked like 10 years ago, thankfully is very different, right? So I think that, I've had a lot of opportunities to kind of learn from the people that, around me, and to kind of grow, in my own understanding of my identity, my understanding of my role. I think, growing in confidence as well, like as a professional, helps, because I do think that so much of the experience of, kind of doing this well, involves humility, and not to say that you can't be humble when you're less confident, but it's a little bit harder because you want to feel like you're doing a good job, right? And sometimes that leads you astray, right? So you want to feel like you understand things, and you want to believe that you understand things, maybe more than you do. And I think that the longer I'm in the field, and the longer I'm in this role, I'm like 15 years, in this site, I'm real comfortable saying that I don't understand something, or that I don't know something, or just, being able to admit mistakes and things like that. And I think that some of that comes from having a little bit more confidence as a professional, and being able to let go of some of those things. So, but anyway, so on that journey, right? So, one of the things I think that has, well, a couple things, right? So one, the big one for me, I think, in kind of the confluence of like my life and my professional work, is having children now, right? So I really think about my clinical career, my work life, as like two distinct phases, right? Like before kids and after kids. That's a whole different podcast. We could have that conversation another time. But I think for me, one of the things that has really, kind of maybe that's different maybe about my own journey now, is kind of understanding what it means to bring children into this world, right? And to think about, my identity, my white identity, my cultural identity, my ability to kind of navigate these spaces, but then also kind of like what I want for my children as well, right? And how, they navigate the world, and kind of seeing things through their eyes, right? And being able to kind of, there's a lot to think about there, right? There's a lot to think about, especially in terms of, things like privilege, right? And what, what experiences they have that were different from mine or my wife's experiences, growing up, and what that means, and helping them kind of understand their place just reminds me how much I have to understand my own place in the world, right? And so that's been something that's, I think, just been a new kind of feature of my growth and development around these issues. But in terms of kind of what has changed, or what it looks like maybe in practice in supervision, right? What it looks like in my work. One of the things, and this is kind of a simple thing, this is not like super groundbreaking, but I think like over the last, 6 or 7 years, I've been just much more taking the opportunities early in my supervision relationships to just share my story, to just talk about who I am, right? Again, I think there's multiple, obviously there's multiple layers of power, in those relationships, right? Especially, the gender dynamics, the racial dynamics, my role now in kind of a leadership position in the clinic, right? Like I can't separate those sometimes from the supervisory relationship. But often I will just kind of start supervision. I'll start that supervisory relationship by asking my supervisees if they would like to hear my story, right? Just to kind of hear who I am, my life up to this point, my experiences as, a child of immigrants, my experience of, being a first generation college student, which, many students, supervisees can identify with. And then just, like how I think about myself in that context. I think those are things that obviously people are curious about and are sitting down with me in that relationship. And might want to know about in terms of, or in knowing kind of how to navigate this relationship and how to build trust and build comfort. And so for me, I mean, it's a couple, it achieves a couple different purposes, right? So one, I'm very relational. So like one is just having people be able to understand me, right? And it's understand who I am, how I think helps our relationship. But it just also just puts those things at the forefront and says, these are things that we should talk about, right? It's not putting the onus, on the student to bring these things up. It's not putting that responsibility on them in this power differential, right? As much as we want to kind of reduce that, it's going to be there, right? So it's not putting the responsibility on them to say, you have to bring these things up, or these are things that maybe are only important to you, but no, these are the things that are going to be kind of central to our work this year. And if it's helpful, here, this is me. And so I found that to really be, very disarming in a way, right? For, I think a lot of times students don't expect that and they're not sure what to make of it. And I always ask, like, is this helpful? Do you want to do this? Because I also don't want to just impose that. Here, let me tell you,
right.
your first supervision, let me tell you about myself, right? Which is not the intention, but this idea that that's not something that happens always in supervisory relationships, right? Where a supervisor will kind of will do that, right? And so I think that has created some really wonderful starts to supervision relationships. And of course, those, the trust and the safety and all that stuff takes time. But I think that, that has felt right, to me in the last, and again, this is, I don't know exactly how long, but, maybe 6 or 7 years. And before that, it's not necessarily something that I wouldn't do, but I didn't intentionally kind of start the relationship that way. And definitely it's something that I've learned, right? I wish I would have maybe done that differently in the past, because I do think it achieves a lot of, a lot of those things and around just, how I would like to set up that relationship very early on. Does that make sense?
It does. It's so helpful. And there's a way that, the qualitative researcher in me comes in. And I think about, one of the main reasons that we offer our researcher positions is for transparency. Right. And an opening up of a conversation. And it sounds like that's what you're doing with your students, but opening up that space for them, right? To be able to walk into that space as well with transparency. Yeah. That's really powerful. Yeah.
And we ask them to do that, right? Like we're always asking them to do that, right? So there's, we're very intentional about, the kind of how we have them think about their own experience and think about their identity, think about their culture, their gender, their sexuality, all that stuff. But then, we're often kind of sitting back and just, we're helping them process it. We're not engaged in it in the same way. And I think, the feedback that I've gotten from students is like, oh, okay, well, all right. So you've thought about these things, right? Which, I don't take that as a dig, right? Like I think, we are thinking about these things, and we really should be, and we really need to be, and to be able to model that, but also to put yourself on that same level of vulnerability too, right? Because we're asking students often to do a lot more than we're doing realistically, right? They don't know what it looks like for us, but then in our relationships, we're not necessarily engaging in that vulnerability with them. So
yeah, that's beautiful. Thank you. So what are some obstacles and barriers on multiple levels? So you've talked about that systemic, situated way that you think about your work. So what are some obstacles and barriers on the individual, institutional, cultural levels that you've encountered as a supervisor working with supervisees and training them to be more multiculturally competent and responsive?
Yeah. I mean, I think it's on a couple different levels, right? So one, just thinking about the challenges, especially, just kind of talk about this past maybe last year or two, right? And just the combined traumas of the pandemic and, social unrest and, police brutality and all these other things, and just the ugliness of the moment around racial issues and issues of equality. Again, I keep saying, right, these aren't things that are not new, right? But I think for students that we've been training over the last couple of years, particularly the students of color that we've trained, the burden of kind of that lived experience of an individual dealing with issues of inequality and oppression, right? In the pandemic, right? So we're all experiencing these stressors and these traumas at the same time, in real time, and then having to be emotionally present and available for our clients who are also going through those things, right? And living those things, just became too much, I think, at times for people. And so we had to really think about what that looked like and what it meant to really support supervisees and to support, trainees in those moments, right? And I think it changed a lot about how I think about self-care too. I think over during that time and how, as an institution, it's not enough to make sure that people are taking care of themselves, right? Like we're complicit in that, right? We have to be part of, kind of how we think about the well-being of the people who are working for us and working under us, right? It's not just to give them ideas about what to do when they're outside of work, right? It has to be all encompassing, right? It has to be throughout their day. It has to be part of their work. It has to be about how we understand their workloads and productivity and all these other things, right? Because it just became too much, I think, for people to really to be able to manage effectively, and be the best therapist that they could be for their clients, right? So that's just a kind of an ongoing, I think, just societal, right, kind of institution, or not institution, I'm sorry, like the more cultural kind of in the air, right, barrier, which is people are going to be impacted by the things that are happening in the world in the same way that their clients are. And then how do you support them to be able to process and be still present and be effective in therapy when the stressors might be the same, and it might be too much to be hearing about these things all day long in the media, be living that experience as a person of color in America in 2021, and then be talking to a client who's also experiencing those same things, and maybe their mental health is impacted by those same things. So that's, one, I think that is particular to this moment, but again, kind of an ongoing stressor. And I would say that another barrier, this is not to like place blame anywhere, right, along the continuum of like academic institutions or training, but we often have students coming to us, and particularly students of color, who haven't done this before, right? Like haven't integrated their own identity and themselves into the work that they're doing and tried to understand how they might have strengths related to their identity and their understanding of themselves that they could bring to their clinical work. Sometimes that's a new thing, right, for people. And it's sad, right? It saddens me a little bit because we've had students that were, doctoral students that are about to go to internship, and they're advanced, their last practicum before they're going to go on internship. And they're being told for the first time that it's okay for them to think of themselves as a Black woman and a therapist, right? That is not only okay, but that's important to the work that you're doing. And that sounds ridiculous. I'm not making that up. I'm not trying to be funny, but that is something that we've literally seen, many times, where this idea that you have to kind of strip away all of these things and think of yourself in a very kind of objective, kind of cold, clinical way. It's just not how we train. It's not how we think. And I understand that that's not the case in every setting, and that's not maybe even appropriate for every setting, but it really is difficult when we have students coming to us that have been just kind of have been trained in this way, and these things have been reinforced where they're afraid to think about themselves, and they're afraid in some ways to be themselves in therapy, and are very far from being able to embrace some of those aspects of their identity as real strengths in the room. Does that make sense?
It absolutely does. What I hear is that sense of being asked to hold oneself to this objective standard, which I have a lot of thoughts about that, but you end up being objectified, right? And a caricature, not fully human, not yourself.
For sure. Yeah, so that it can be hard then, right? I think that intuitively it appeals to those same students, right, who may have been conditioned to think this way, because they're like, oh, okay, well, like, this is me, right? Like, this is like, talk about confidence, right? Like, if you're being told that, like, the thing that you brought into the room that was just with you all this time, that you didn't need to go to school for, you didn't need to learn, you didn't need to do a dissertation about, you didn't need to train for, this is just you, all the aspects of your identity, your experiences as a person are super valuable in this setting and are super important to you being good at this work. Wow, right? Like that's intuitively, that's great. People are like, okay, this is like, I like that, but they're fighting, sometimes it's butting up against this idea that, is it okay to talk about that? Is it okay to acknowledge those things? Is it okay to be myself, in some ways? And so that, sometimes like unlearning those things. And then also, I think, part of me also feels like, a little bit apprehensive, right? Depending on where they're going next, right? So then are we turning people out into the world thinking a certain way that really kind of gels with how we think about therapy and how we think about, these issues of diversity, right? But then maybe are they going places maybe where those things are not valued as much, and then are we setting them up for failure? And then it kind of circles back, right? So then me being a white man, right? Then there's the consequences for me are going to be less in the world, right? So then am I setting up, I don't want to be in a position where I'm setting up people to then have some of those negative experiences perpetuated, because it wouldn't necessarily be the same for me if I were to do those things, right? Like I wouldn't necessarily be perceived the same way. And then is that fair to set people up to go out into the world and then experience that? So yeah, definitely it's tricky.
It is tricky, and it reminds me of your comments to the first question, where students want to come in and learn to do, right, and you're adding these contextual complexities to the question. And there's a lot to learn at once. And so similarly, there's a beauty in embracing oneself and teaching students to do that, but the complexity is also helping them to navigate the other systems that they'll engage, right? And realistically what that could look like. Really appreciate that. I do want to go back and reflect for a moment on your first part of the answer. And I really appreciated what you shared around self-care and the rethinking of self-care in this time in particular. And two things, that parallel process that we're all experiencing and how to name that, right, as a supervisor. But then the other piece is also thinking about self-care not as someone's responsibility, but systemically. What are the systems that we're setting up in which folks can thrive and do their work? I really appreciated those points. All right, next question here. This is a long one, so I'll break it up too. How have you been able to recognize and integrate the various social context and intersectionality issues when working with supervisees, especially those who may not believe that they've been directly impacted by systemic racism and issues of equity and social justice, right? So those who don't think they've really been impacted. In general, what's been the most challenging around that for you? And what does that look like? What are some examples?
So, right. I think, one of the things that makes, it makes supervision interesting and rich and just keeps you on your toes is that, our cohorts of students, we typically train 10 students a year in our cohort, and it's a diverse group, right? So it's culturally diverse, just in all of the variables, right, of gender identity, sexuality, religion. It's just that people are bringing very different perspectives, and so I think what has been what's always, I think, one of the biggest challenges is really recognizing and accepting where people are in their journey, right? That everybody is going to be somewhere different, and we just have to be okay with that, right? From a training perspective, right? And I say that because it doesn't always, it doesn't look pretty always, right? It's not always a beautiful the process, right, is not always beautiful. I think a lot of times the end result is really beautiful, but I think, sometimes there's some bumps in that road, right? And so I think when we have students that are coming to this discussion, and these, it's particularly, I'm thinking about like our group supervision, right? When we have all of the trainees together with, two supervisors, and we're talking about cases, but we're also talking about identity. We're talking about relationships. We're talking about all, the world. We're talking about everything in that context. People are going to be at different places, right? And we have to, and I think that the challenge is, sometimes, knowing when to amplify a voice, knowing when to try to maybe quiet a voice, maybe when to, just how to facilitate in that context, right? And so, when a particular, a kind of common example, I would say that happens, and I think this happens probably in a lot of training contexts, is that in a diverse group of students, the students of color don't want to be the ones teaching things, right? They don't want to be the ones who have to explain certain concepts. They don't want to, it's not their role. It's something that I think often that role gets forced on them in school, in the world, right? In their day-to-day lives, right? And so I think, being a supervisor and being very cognizant of that, right? And then knowing when, I'm always a person who, I think in supervision, I always like to kind of support the process and, kind of allow students' voices to be at the forefront. I don't necessarily, if someone else could say what I was going to say, that's better than me saying it, and just for the relationships and the cohesion and the power stuff. But there are times when I think I have to know when I need to say something, especially again, as a white person in those spaces, right? So when we get into conversations where that highlight, things like white guilt, right? Like where white students are expressing things around, where they are in their identity development might be that they're feeling guilty or they're feeling, and this is a common experience I think that white people have in their identity development, right? As they're moving through that journey themselves. Issues around white fragility, right? And how sometimes that could potentially shut down, discussions in a diverse context, right? So knowing where I need to be a little bit more active, right, in those discussions, in order to not perpetuate dynamics that are maybe harmful for some students that are happening in other places, right? And being mindful of how to do that with grace, and how to do that. I'm not saying I always do it with grace, but right, that's the goal, right? But how do I do that in a way that that respects where people are, right? Because it's not that a student who's experiencing, white guilt is less worthy of that understanding or that grace or that respect and that discussion, because the goal is always the same, right? We just want people to move along that journey while they're with us. They don't have, how much they move along that journey is up to them. But we just want people to be reflecting on things and to be thinking and moving, right? And not perpetuating, again, some of those harmful dynamics that are happening maybe, in other places in the world. So yeah, just knowing when to, when to step up, when to step back. It's just an ongoing, an ongoing thing to kind of calibrate. I'm not sure if I totally answered your question though. What can you say the first part again, maybe?
So being able to recognize and integrate social context and intersectionality. And I think that the piece about working with supervisees who may not believe or understand or see how they're impacted by equity issues, especially in their work, like if they haven't had that experience. So I think in part, is there anything else you'd want to add to that piece?
Yeah, I mean, I think the other piece too is, again, I think this goes back to something I was talking a little bit about earlier, is I think it is a little bit more of an advanced skill for a clinician, especially a clinician in training, to be able to hold all of those things at the same time, to hold what's happening in the room, the history I know about this client, the symptoms they're experiencing, their diagnosis, plus the social context, who they are in their family, what neighborhood they live in, what school they live in, go to, all of these other things, right? So it is an advanced skill, and I think that it is almost protective sometimes for some students maybe to try to minimize, or at least the belief that those other factors, those contextual factors, may be as important or more important than the other stuff, right? So no, you know, when we see that, people are trying to kind of strip out some of that context and really just kind of look at this individual, their intrapsychic experience, maybe just like one layer, like just their relationship with their parents or something, you know, just one kind of, you know, one systemic piece, really challenging them to broaden and to start thinking about and integrating those other factors. And sometimes it's just a lot for people to juggle, right? And it really, and I think, you know, again, I think it really cuts to some of the insecurities that you know, that clinicians in training, you know, have about their ability to affect change. And I think that, and it's something that I always come back to, right? It's like, when you're mindful of those other contextual factors, and you are integrating those contextual factors, that understanding of those things into your conceptualization, into the relationship, it doesn't mean that you are necessarily affecting change at those levels, right? Like that's a whole different thing, right? But we're just using that information to broaden and deepen our understanding of that individual and their experience of the world. But I think that sometimes, and hopefully this makes sense, right? That students kind of conflate those two things, right? That if I start to think about, okay, my client, you know, is a 12-year-old African-American boy in North Lawndale, which was, you know, our setting. And I understand that maybe their experience, you know, they're going to a school that is kind of substandard, and that they're experiencing systemic oppression, maybe because of some of the, you know, aspects of the, you know, school to prison pipeline that might be kind of, you know, kind of functioning in their educational environment. The feeling then that, okay, well, I have to change those things, right? Like I have to change the school to prison pipeline now. Like I have to be working at that level if I want to help this kid. They're not the same thing, you know, and yes, you know, there are interventions and there are ways of thinking about your role as a therapist, even that go beyond the room, right? And to go beyond the individual. And there are ways that we can affect change at those other systemic levels, especially, you know, with advocacy in schools and that sort of thing. So that is part of it, but it's not just changing those things. It's also understanding your client's experience as a person in that context, and that will help you treat them. And that's a little bit less overwhelming, maybe, I don't know, or a little bit, you know, when you kind of situate it that way, I think then students can kind of take a breath and be like, okay, you know, that's what we're talking about. We're still talking about this, you know, we're not talking about all these other systemic factors that, you know, seem unchangeable sometimes, right? Or seem, you know, at least, you know, very difficult to change, right? So we're not saying that it has to happen there, that you are going to be the agent of change at that level, but you're going to be able to better help and serve an individual if you understand them in all those levels. Does that make sense?
Absolutely.
Okay.
Absolutely. It's actually related to the next question. And you've answered it in part, but I would love to hear a little bit more of a direct connection. How do you promote or teach culturally responsive interventions? And what seems to have worked with your supervisees?
Yeah. So, you know, one thing that we really try to do in our training program that's just an important part of just kind of the background of and the ongoing kind of learning environment of the year is that we really try to not make issues of diversity and, you know, cultural issues and cultural humility and awareness be these little pockets or these little, like, you know, doses of information that people get, but that this is something that, you know, if we really want this to be, you know, the way that we intend it to be, and we really want this to be helpful, it has to be integrated at all levels, right? It has to just be part of every aspect of training in every way, so that it's not just, you know, where we're focusing on these things in these little discrete moments, and then those discussions stay there or whatever, you know, that this is something that, you know, and so, you know, we'll have these didactic seminars that are more experiential, right, around diversity issues throughout the year, that are a little bit more, like I said, more experiential, kind of meant to maybe kickstart that process a little bit, push the process a little bit farther, so that with the intention that those discussions around, you know, privilege and identity and all of these things are happening then in all of these other contexts, and that we capitalize on those moments to maybe to you know, take it to another level, but that it should always be happening in all places, right? And that's hard, and it's not always easy to do, but I think, you know, that's something that we really, as a training team, try to keep in the forefront, right? That's not that we're tacking it on, right? Or it's just added on to the end of, you know, a discussion, or there's one seminar or something like that, but it's something that we're really, you know, doing throughout the year. And then, you know, I think another way too is kind of thinking about, you know, our population and, you know, the all of the, you know, the kind of language around evidence-based treatments, and, you know, kind of how we choose interventions that are you know, appropriate to our population, and kind of challenging and pushing back, I would say, a little bit on what it means for an intervention to be sensitive to our population or be appropriate to our population culturally, right? Which the reality is there just aren't many evidence-based frameworks that are normed on our population, right? And the complexity of the stressors of individuals who have experienced, you know, generational oppression and poverty, and, you know, continual systemic oppression, and just multiple stressors and barriers related to that. Living in neighborhoods with, you know, community violence, living in neighborhoods with substandard schools and housing insecurity and food insecurity, right? You know, just really being good, trying to be really good critical thinkers about, you know, when I'm applying this framework to our, you know, is this framework first appropriate to apply to our population in ways that really are sensitive to, you know, their needs and their experience, and that are not, again, kind of perpetuating some of that disconnect and some of that, you know, oppression by us, that we are not perpetuating those same things, right? And that gets tricky. It gets really, you know, it gets really tricky to do, right? And to find approaches that that are, you know, we want our work to be rooted in evidence, right? We want to be successful with the interventions. We want to be able to help, you know, individuals. But what does that mean sometimes, you know, when we're looking at populations that are often kind of absent from the development of those interventions, right? So I think, you know, so on one level, it's, you know, applying that critical lens, right? That critical eye to any intervention framework that you're going to be using, so that you are the person then who is, you know, consistently kind of checking, right? And thinking about the assumptions of that approach, and how does that, you know, does that, again, perpetuate the you know, some of the problems that are happening, you know, for you know, some of the stressors that your clients are experiencing, or does it kind of understand those barriers, limitations, understand strengths, and so yeah, so, you know, we've found, you know, the most success, I would say, we've found with frameworks that really prioritize, you know, just kind of the relational aspects of therapy, attachment work. You know, we're working often with you know, children who have experienced complex trauma, who have, you know, disruptions in attachment relationships. So I think, you know, the intervention frameworks that focus more on, you know, dyadic relationships between caregivers and children, those attachment, you know, that attachment lens, that trauma-informed lens, tend to be things that I think, you know, also, even though they're not specifically, you know, addressing those cultural, you know, just kind of the cultural and systemic issues, they do a better job then of meeting. We can do a better job than of meeting our families where they are, and understanding their experience, but understanding barriers and also strengths, right? And kind of being able to capitalize on some of those strengths. Things like ARC, we've used ARC a lot. Shout out to ARC, the attachment regulation and competency framework. It's a wonderful evidence-based framework for working with families with who've experienced complex trauma.
Yeah, that's really helpful. Related, I'm curious about the bridge. So,
Mhm.
how do you teach your students and supervisees to translate their awareness, right, like that
Mhm.
critical lens and knowledge to action when it comes to
Mhm.
actually providing the interventions?
Mhm.
What does that look like? Can you
Yeah.
give an example of
Yeah.
teaching them to have that critical awareness and then how that translates into what they actually do with clients?
Yeah. Yeah. So sometimes I think it's really just giving them permission to name the things that they want to name. So sometimes that awareness is there. Like I said, it's just, giving people permission to talk. So a perfect example, this happens a lot, where, um, a student, in supervision will be describing a case and we'll be talking about, I'll just kind of give maybe a typical example or a common example that we've seen. So the, clinician is working with 8-year-old African-American boy who is, having some trouble in school, some difficulties maybe with attention, some difficulties with, some behavior issues in school. And in the assessment, the parent is talking about their experiences at the school and is not totally in agreement with how the school is assessing that child's behavior. And then the student gathers a little bit more information, and Chicago's super segregated. Our school system is extremely segregated. And then the student finds, the therapist finds out that this young African-American boy is attending a school that is not predominantly African-American, maybe predominantly Caucasian or Latinx. And these problems just started when the student transferred to the school, so things like, so you can kind of see where this is going, right? And I'm not saying that, this is always, it's that simple, right? Or it's that cut and dry. But the student will be presenting this in supervision, and and then we'll get to the point where we're all thinking, we're all thinking the same thing. And I'll say, what did you say to the parent about this? And like, I don't know. I didn't know if I should say, like, is it my place to say that, that maybe it's the school, right? Or maybe it's right, the fact that, there's tons of research that shows that, African-American boys' behavior is, seen as more aggressive or problematic in school settings than the same behavior, by other children, right? Like we know that this is something we know. There's research about this. This is something anecdotally we've experienced, but they can't make that leap, right? To say to the parent, well, yeah, you're right, right? Like I hear you, right? Like that, not only is that extremely validating for the parent to say yeah, well, maybe this is a problem with the context, or this is a problem with the school. This might not be a problem with your son, right? Or just the fit between the environment, right? But that this is not a problem with you, right? As a child, this is an environment that is not supportive of you and needs to change, right? That's extremely validating. It's liberating, right, for parents to feel, but the student like can't make that leap because they're like, well, is that my point? Is that my place to say that? And then, so then the next, part of the conversation is, well, yes, it is your place to say that, right? Not only is it your place to say that, but you have an obligation to say that, right? But you have an obligation to, the impact of those things, right? The impact of systemic racism, the research on this. You need to throw that out there. Not to say that you're going to say this is exactly what's happening, but I wonder. So then, the student will often go back to the parent that maybe the next session after having a little bit more, encouragement and some confidence, and will say something like, well, I wonder if it has anything to do with the fact that, he's, one of the only, Black children in his class. And then the parent will say, well, of course it is, but like, why, why didn't, I didn't know you wanted to talk about that, or I didn't know you would
open up that space.
Yeah, I didn't know we could do that. And that's the other piece of it, right? Is just putting it out on the table, right? And then especially in this position of power, right, as the therapist, and especially like me, I'll go back to me, right? Like being a white therapist in that context, me putting something out there on the table saying it's okay for us to talk about this is extremely important, right? I have the most to lose, right, in it being in a person of like kind of dominant culture to open up that discussion, right? Like like privilege and power is perpetuated when people don't talk about those things, right? And avoid talking about those things. So for me to say, as a white therapist in that setting, we have to talk about this. This is what I think might be going on. That opens the door for that conversation in a way that where the client can take it or leave it, right? They don't have to necessarily walk through that door, but it says, I'm open to have this conversation. This is something we need to do. So then when the student is able to say that to the parent and say, well, I wonder if this is, I wonder if it might be because they're like, well, of course it is. But I didn't know that that's where what you could do to support me or help me. The parent might have been thinking that this conversation was going to go to, or this treatment was going to go to, how can we help, kind of fix your child, or how can we, where now the thing that they already believed going into the therapy relationship is being confirmed and reinforced, that now we can approach this problem from a different angle, right? And I'm in support of you and your experience. Does that make sense?
Absolutely. It offers permission, and it opens up that space for that level of conversation, but then also that level of intervention. Like, so what can we do to think about what the space means for your youth, and what we want it to mean, and what it could mean.
Right.
Yeah.
And I think, I think that making that bridge then between the conceptual part and giving permission for the student, right, from the conceptual, like, yes, I know these things to be true.
Yeah.
And then saying, you can actually talk about that in therapy, right? Like, that's actually something that you can talk about. You can actually talk about those things, and you can actually validate those experiences. Sometimes that's the disconnect, right? It's like, how does it become like, how is it therapeutic? Like, why is it then, I don't want to make it about me. These are valid concerns, right? These are things to always think through, and for any therapist to be mindful of, right? Like, when is it that, like, am I introducing this because I want, is this about me? Is this really what the client needs? But giving that permission to bridge those things and to actually introduce those concepts into the therapy space, that's sometimes the biggest, the biggest hurdle.
Yeah. So much there. Yeah, thank you. So you mentioned self-care earlier, so I want to go back to that, right? As a clinical supervisor, how do you take care of yourself? We know that self-care is critical to prevent burnout. What do you do? What do you recommend to others? What supports do you have in place to practice your own self-care?
Yeah, no, I think this whole the pandemic really made me think differently and think more about self-care and what it really meant, and especially just what it meant for me. What were the things that I was doing or not doing that really were important? So I'll just use myself as an example. Being part of a team is really important to me, and so I always knew that, right? But I never thought so explicitly about how all of the interactions and relationships that I had with people at work were pretty much like, that was the biggest part of my self-care that was kind of invisible, like it was just there, like it was, but when it was gone, that's when it became super noticeable. So I'm a very social person. I was withering during the pandemic. I'm not a good person. I'm not good at working from home. I was, most of the pandemic, I was in the hospital. I was on site with one or two other people. We were in separate offices. It was hard. It was really hard, right? So just all the little interactions, all of the conversations, all of those things are just, so much the things that sustain me in that work. So it's not even, I don't even think about that as self-care, but that's really, what I think has allowed me to do this work, to work with families who've experienced, really intense trauma, to do really difficult work emotionally for such a long time, is that I'm surrounded by really great people. I'm surrounded by people who are super passionate about what they're doing, who really, I can't imagine myself doing something different. Most of them feel the same way. When you're with people like that, that's huge. That's huge for sustaining, you. It just me. I'm talking about me, right? It's huge for sustaining me as a person in that context. And then when that was gone, I was like, wow, this is hard. This is not, I'm not enjoying this in the same way. And then the Zoom meetings and, instead of the in-person stuff, you're just like, there's just this layer, this barrier. Yeah. So it definitely started taking a toll, on me. So I had to, so I just had to think about that, where I was going to get that, right. How I was going to kind of fill that in addition to the other things, right. Like that I like, or that, are meaningful to me, that sustain me. But I think what changed so much for me in thinking also about how to support my staff, right? Again, being the manager of a program, in addition to the director of training role, then there's like those two layers, right? Like, how do we support, our students, but then, the supervisors, the training team, the rest of the staff, right? And so, I think there was, there was a sense, and I don't know if you felt this, but there's, some memes and things that you'd see that were, I think there was some real anger around institutions offloading the responsibility of self-care onto individuals, right? Like onto the workers, right? So that, like, this feeling that, which people have had, I think, for a long time, but it really felt like it came to a head during the pandemic, that like self-care just means like taking care of myself so I could work more, right? And that's like, I never want to be that person, right? So as a leader, I never want to be the person that my team feels that I only want them to be good, feel good and be able, so that they can work more, right? Like that really just resonated with me. And so yeah, thinking about, that it's not just the burden of self-care is not just on the individuals, not just on employees to figure out, like, what yoga class you're going to do to feel better after work, or take up a hobby, right? Like those are all good things. I'm not downplaying those things. Those are all important, right? But it's also the responsibility, I think, of the institution, of the setting, of the work setting, to incorporate that at every aspect and adjust expectations accordingly. So to me, that was the biggest part of it, right? So that we just can't be in the pandemic expecting that all of our metrics are going to be the same, our productivity is going to be the same, our billing, all these things that you have to worry about as a, in leading a program, right? That our billing is going to be the same, that our, that everything is going to be the same, right? Because it's not. The world is broken right now, and the world this is something that we've never experienced, right? So we can't go into it saying that, everything is going to be exactly the same, right? So how do we adjust those expectations? How do we give people the time that they need? How do we, help people access, leave when they need to take leave from their position? How do we, help people structure their days in ways that sustain them, right? How do we do things? How do we offer things as an institution that are part of people's day or part of their week or month, that are also self-care, right? That are also part of, it doesn't just have to happen at 6 o'clock or 5 o'clock when you get off of work. Like, so you can't cram all your self-care into, from 5 p.m. until you go to bed every night, right? It has to be something that is woven into and integrated. And sometimes again, it's just about adjusting expectations. It's not about, we're going to do a yoga class at work, but it's about, maybe our expectations for productivity are going to be different this month or the next month, or for every month from now until the world is fixed, right? So we can't just do more and do the same thing when people are struggling and people are hurting and people are tired and all of that. So did that answer you? I want to make sure
It does. And I'm curious. And so it sounds like for you, that there are a number of different perspectives, and that as a manager, thinking about what this means more broadly. And, as a manager of the program, but then also with, the training team, and you have a group of supervisees that are looking to you to figure out, okay, what now? Right. What are some specific things that you do for yourself? Or like, what does this look like for Dr. Staszko? Oh, not Dr. Staszko. What does it look like for Greg?
I'm happy to talk about that. I don't know how interesting that is, but
extremely.
So a couple of things. The one is I bike to work a lot. That's a big stress relief exercise. It's stressful for me to figure out how I'm going to exercise during the day. I have two young kids. I have a 7 and a 6-year-old. So a lot of my time outside of work is spent with them, and it's they're the best people on earth. And so that I can't, I wouldn't want to spend my time any other way, but it does not leave a lot of time for me. So biking to work, having an hour on either end of the day, morning and night, to myself to be exercising, but also just, decompressing, being outside. I hate being in traffic. So not being in the car, not being, stuck in traffic, being outside, getting fresh air. That's a huge part of my self-care. That's a March to November thing though, in Chicago. So it's not the whole year.
Yeah.
And it's definitely, weather permitting. So that's a big part of it.
Mm-hmm.
But I gotta, shout out to my kids again, the time, so much, I think, and I don't even think of it as self-care, right? Obviously, but like so much of the time that I spend with them is just, it's such a wonderful to get into their minds, right? And think about how they see the world and how the stuff that they talk about and their goofy senses of humor and their, just all their idiosyncrasies. And that is something that is a huge part of just grounding me, and just listening to their stories of their day, when I come home, is just, something that just, it takes you to, it just transports you somewhere else, out of the mundane and the stress of work and all that. But and then music is another, that's a huge part of my life and my identity. And I've been a DJ for many years, and so my just love of music and kind of using that as a way to decompress and just appreciate, and just again, like in the same way that seeing the world through my children's eyes is beautiful and kind of takes you somewhere, just the experiences of listening to music, right, and discovering new things and hearing sounds from different perspectives, and hearing how people take their life and experience and their perspectives and put it into this expressive form, just takes you somewhere too, and it's definitely a big part of what kind of feeds my soul and kind of keeps me going. So those are probably the biggest things, I would say.
Yeah, that gives a really important, beautiful snapshot. So thank you for sharing that.
Yeah.
So, this whole podcast series is in an effort to help us as clinical supervisors to be able to think about the work that we're doing interculturally in training. So if you could imagine, right, like what else do you think that clinical supervisors could use in terms of training around intercultural supervision? What are some elements?
Yeah. That's a good question. It's tough, because I feel like so much of my experience of being a supervisor, right, it was just, you don't learn how to be a supervisor. I mean, really, like that's the dirty secret. The dirty secret of supervision, right, is that when I remember being a student and sitting down with a supervisor and thinking like, man, this person knows so much, and they're so like, they're just, and not to say that they didn't, right, like
right, of
shout out to all my supervisors, are all wonderful, but you don't really get trained on how to be a good supervisor, you know what I mean? And I think, some programs have more or less focus on that, but really you're just you're learning by doing, you're learning by you're kind of learning on your feet. And so it's hard to say, because I didn't have those things, right? What would have helped me? But I do think that, just really kind of challenging yourself and being, and whether this is in a training context or even just like, maybe like a peer consultation group or something. We have in our program, in our training program, we have one of our more senior supervisors, one of our more senior clinicians leads kind of a group for the newer supervisors, right? Who are part of, who are newer to our training team and maybe have less experience, supervision. And it's a place for them. We try to use our training meeting, our weekly training meetings to do some of this, right? Like processing of, just issues that are coming up in supervision, things that people are struggling with, like more of the kind of the deeper kind of richer aspects of supervision. But then a lot of it ends up being procedural, kind of logistical stuff and going over evaluations. And, so we don't always have the time to do that together as a team. So we set up this separate piece. And I think that has been, just hearing the feedback from newer supervisors on our team, this has been so helpful of a place for them to do this part, right? That we're talking about, like, to explore their identity, explore their insecurities about supervision, to explore all of the things that they want to do better, or that they wish they did the next time, talk about those moments that they didn't feel like they handled super well. I didn't, have necessarily like a formal opportunity to do that, but kind of, try to seek that out as I could in my other professional relationships. But I do think, like, as part of like training for supervisors, I think like having that a little bit more of that kind of unstructured, process oriented supervision for supervisors could be so helpful. And just, especially as a place to continue exploring those identity variables that we talked about, right? And where you are in your comfort in addressing those things in supervision, and how to become more comfortable and to learn from your peers, about that. And just giving, having supervisors, I'm not saying everybody has to do it the way that we do it, or do it the way I do it, but giving supervisors that permission and encouragement to share more of themselves and their identity and their development and their process, and the transparency piece, right? So you mentioned that earlier, again, being a white person in that setting, being a white supervisor, all I have is transparency, right? All I have to help build trust with people and to build comfort in relationship is for people to feel like they know what I'm doing or where I'm going at all times, right? It shouldn't be a surprise. It should, and for people to have a window into my experience and my process is helpful, right? It increases trust, it increases safety. So giving supervisors permission and encouragement to do that, right? To share themselves, who they are, how they think about things, what's their lens, what's their cultural lens, how do they see the world based on their own experiences in their own family, and and because of their all of those variables, right? But kind of putting that at the forefront, where that's as important as your student doing the same thing. I do think that just opens up some really interesting conversations. It just opens up some interesting, it deepens that relationship a lot.
Yeah. Thank you. Those are some really helpful, practical, and doable things in different settings. So thank you. We're at our final question, right, for today. And so you've talked quite a bit about journeys, right? What keeps you going in your journey? How do you continue to stay encouraged and hopeful despite setbacks, especially in light of all that's happened, the layers of what's happened over the last year and a half? What keeps you going?
Yeah, it's a good question. Part of it is that, as I kind of alluded to before, I can't really see myself doing anything else. And so I think that helps, right? Like when you feel like you're doing the thing that you're supposed to be doing, that really helps you to want to keep getting better at it and doing it better. And the fact that I've had, as much as I think I know about things, I've had moments where I was, knocked on my butt, right? Recently, right? In the last couple of years, every year, right? Where I thought I knew something, I thought I got something and I didn't, right? And those are just those moments where you're like, oh, okay, well, just more to learn, right? There's more to do. And I think as my role has changed, and I've had to think, more about power and privilege in a way that I've that's different than I had been thinking about it before. Not that I hadn't been thinking about those things, but being in leadership roles, right? Especially, given, the fact that I'm a white male in this context, right? Like that's something new to kind of think about. And I want to be good at it, not in the sense that I want to achieve something or, but I want to do good by the people that are trusting me, right? I want to do good by the clients and the families that are putting their trust in us in our clinic, but I also want to do good by the individuals who trust me and are taking a risk, right? Are taking a risk to trust me as a leader, that I'm going to represent them and represent and support them, and I'm going to try my best to understand them, and I'm gonna promote the things about them that are important, and I'm going to help sustain them in that role. It's just, I don't know. It's hard to say, when people ask why do you do what you do? Or I find that a hard question to answer, just because I don't know what else I would be doing. That sounds weird, but I just feel like this is something that, the work that I get to be a part of, and to be on a team that is doing the thing that they love. There's nothing like it. There's no other experience I've, had in life that is as fulfilling as when you feel like you're doing the thing that you should be doing, and you're surrounded by people who are also doing that thing. And you're trying to figure it out together. And yeah, that's what has made me just want to be, it's addictive in that sense, right? That you just want to be better at it, so that it continues in the way that it, and we've had a lot of obstacles, right? So to keep it continuing in a way that feels good and that stays true to our values and stays true to our beliefs in the face of all of these, kind of systemic obstacles, that feels like a challenge too, so that's another thing that, kind of drives me to keep this thing that I love and that I see being so important to so many people, to keep it going in a way that allows it to keep, healing the community and keep healing, people and impacting their lives. There's really nothing like that.
Well, thank you so much. I mean, I think that's such a beautiful, authentic, heartfelt, and knowing you, so true perspective. And I'm grateful to have sat and learned with you today. I'm grateful that so many will learn from your perspective and your journey. Thank you so much for sharing with us.
Yeah, no problem. This was great. Thanks for having me.
All right.